Hi, Tom Bialik of the Munster Chamber of Commerce, one more time with another installment of Munster Chamber Chat. Today we're in Highland, Indiana at the Office of Health Diagnostics of Northwest Indiana. We're joined by Dr. Vijay Kumar Dharla. Doctor, welcome.
Thank you.
And also Anna Maria Haro. Thank you so much for having us. Doctor, let's start with you. Doctor, tell us just a little bit about your lab.
Well, this is a thing that a concept that I found out would be a niche in the industry right now. And so I started this about 9 years ago. And I studied the market and saw everything, and I felt this was something I should do. Okay.
Sure.
Yeah.
So your lab, you go through many different types of diagnostic exams. Is that correct?
Yes, we do a lot of those. But the mainstay is that the main thing is that our prices are the lowest around over here, and that's the main attraction why people come to us. The industry is so diverse that hospitals charge a lot of money, and sometimes what they charge for a simple bunch of tests is the salary of a whole 2 weeks salary of some people. Mm-hmm. And it is prohibitive for some people. They don't even go and want to do the test because they can't afford it. And this is where I felt money should not play a role in their health care, and hence I've been doing this for a long time. I always felt that money should not play a role in any way, in treating people or in getting them to do what they want, like the labs and so on.
Absolutely. That's very interesting. Anna Maria, what is your role here?
I wear many hats here. I work front desk. I'm a phlebotomist. I also do the billing and coding here. Like Doctor stated, we are a discounted lab. We cater to uninsured patients, but we also cater to patients who have insurance but just can't afford the high deductibles. Mm-hmm. We are an out-of-network lab here with all insurances, but that's just to help the patient. Whereas if they were to go to an in-network lab, say the hospital, they're going to cover their labs, but they're also going to have a balance. Mm-hmm. Here, if those insured prices cover our discounted prices, all of those are written off for our patients. So we try and help our patients as much as possible.
That's very interesting. Dr. Dharla, let's talk a little bit more about this insured versus uninsured patient. Now that we know that there's been a lot of change in the healthcare industry when it comes to insurance over the last several years, and quite honestly, many of the insurance plans may not be advantageous to the patient or to the individual. How does your lab come into play when it comes to the patient's insurance status?
Yeah, a lot of people may have insurance, but they all have such high deductibles that they still get a lot of bills, heavy bills. And when they come to us, if they have a high deductible, they don't even have to go through insurance. So when they pay out of pocket, it's very cheap. And otherwise, when they do, bill the insurance, and they're required to pay 20%, that 20% is so high that they could do our test 4 or 5 times sometimes.
So if I understand you correctly, then many of the same tests that I would go to a standard lab and get my insurance card and pay the deductible, you're saying that those same tests would be less expensive to just pay cash? Yeah.
It's much cheaper to come and do it here rather than go through insurance many times. Especially if they're healthy, they barely use their insurance, they may never meet their deductible in the whole year. Okay. So such people, I advise, should just come pay and go without worrying about insurance.
Very interesting. Anna Maria, how long have you been here?
Going on 3 years now, but I've known Doctor for years. He was actually my instructor in medical school. Okay. And after my externship, I was laid off years later, and I came to work for Doctor.
That's great. Now, Doctor, many of the exams that most people would normally come in for perhaps would require a doctor's order. Is that the case we hear?
No, if they're going to pay from their own from their own pocket, so to say, they don't need order. They don't need orders. It's only that a requirement when they ask us to bill their insurance. Is then we need an order.
I understand. How long has your lab been here?
About 9 years. Yeah.
And prior to that, share a little bit about your background.
Oh, I'm a medical doctor by training, MD, and also a pediatric surgeon by training. Way back home in India. When I came here, I couldn't put my foot in the door for so many other reasons, non-connected to medicine. like immigration problems and taking long and things like that. So I found a niche in this field, and I jumped into this, and it has been helpful, been productive. I feel glad I'm able to help the community in some form or other.
Can you give an example of one test, perhaps, that that I may come here and say, listen, I need to get my cholesterol checked. Give me a little comparison, if you would.
Just let's look at this very first test, which is the most common test, which we have called as HD profile, standing for Health Diagnostic Profile. It comprises of CMP, CBC, and lipids. Now, these are common things required for wellness screening. Now, this is an average cost of most hospitals. And if they charge $820, we charge just $45. And I want to assure you and reassure you that we are not compromising on quality, even though we're offering such a low price. We use the same labs that they use. And actually, the major lab that I use is the one that services Northwest Memorial Hospital in Chicago. So, once you know Northwestern, they go by very high standards. This is the same kind of lab that I use. Not kind of, it is the very same lab. Okay? And so quality is not compromised, even though we charge so little.
Well, that's quite a difference, $820 versus $45.
Yes.
Again, considering the insurance landscape that we have today, I would assume that many people might be interested, me included, in taking advantage of some of these exams.
Welcome. That's what I'm all about.
Well,
trying to save people money.
There you have it, ladies and gentlemen. Some very interesting things happening here with Dr. Dharla. Anna Marie, thank you so much for your time. Now, if someone wants to schedule some time here, schedule an appointment, what do they do?
Let me tell you. That's another thing. I've dropped all red tapeism. We do not have appointments. You can just walk in.
Okay.
They may call us if they have any questions about whether they should fast or not, or if they want to know approximate prices. Yes, people do call us. But we don't have an appointment system. They can walk in whenever they have the time. I don't want them getting killed trying to meet an appointment time, trying to rush and break the rules and get caught by police or something like that.
No, we don't want any of that. Is there a specific phone number that someone could call if they want more information?
Our number is 219-836-5799.
Well, there you have it. Some very interesting things happening here. Thank you so much, Dr. Dharla. Anna Maria, thank you. Thank you for your time.
Thank you, Tom.
Tom Bialik. Oh, thank you, sir. Tom Bialik with the Munster Chamber of Commerce one more time. For more information about the Munster Chamber of Commerce, look up our website, munsterchamber.org, or give us a call at 219-836-5549. Tom Bialik signing off. We'll see you next time